Patella Bursitis, commonly known as housemaid's knee. This is effectively a bursa is a fluid-filled sac. I'll explain that first, which is in other areas of the body as well. We mentioned the site bursitis in your shoulder, bursitis in the hip potentially. There's other areas you can get bursitis. But in the front of the knee, Pre Patella Bursitis, this is the kneecap being called the patella, or housemaid's knee, is an inflammation of the bursa, which creates more fluid, and the inflammation of that bursa and the fluid creates swelling. The swelling then creates pressure, which causes pain. Typically it's due to trauma or kneeling too much or unaccustomed use of pressure on this area here of the knee. Can be caused by other reasons. I think about 30% of the cases it could be infected, in which case if it doesn't settle down quite quickly you need to seek medical advice. Treatment for Pre Patella Bursitis is, as it's an inflammatory condition, it would be to reduce the inflammation, so perhaps talk to pharmacists about anti-inflammatories. You can use anti-inflammatory approaches yourself, such as putting ice on the area, taking it relatively easy, not overdoing it, letting the swelling reduce, letting the situation calm down. Anti-inflammatory gels can be quite effective in this case because it's quite superficial, it's quite close to the skin surface, that means. So putting gel on an area which is quite close to the skin surface, that's inflamed, can be really helpful at reducing that inflammation. Plus you don't have the gastrointestinal issues that some of the oral anti-inflammatories might have. Again, if you have any doubts or any questions, talk to a GP or a pharmacist. But reducing inflammation, it's not the sort of situation where lots of heavy squats, loading the area, lots of heavy rehab will make a big difference. We need to calm the situation down before we consider doing anything of rehab and more aggressive physical exercise. So that's Pre Patella Bursitis.